We all know what this is instantly, don't we? We could see that this is a very thick wall of smooth muscle, and here is a thick wall of smooth muscle. So this is an organ with a thick, smooth muscle wall that has been cut. And here you could see that this is the cervix of this thick-walled smooth muscular organ. And here is the other side of the cervix. And this 1 or 2 millimeter nice thin rim of juicier looking internal covering to this smooth muscle is the normal endometrium. Up here it looks like it might be perhaps a couple millimeters thick, maybe only 1 over here, but overall it's rather uniform. But when you open this up, you see that there is an egg-sized or grape-sized at least tumor occupying most of the internal lumen of this uterus. Notice how it also has a smooth surface. Notice how it's attached to the wall, an area where the wall is rather thin over here. And it's almost like you could pick it out like it was a berry or a polyp. This is an endometrial polyp. We've seen colon polyps. We've seen polyps of the nasal cavity. We've seen fibroepithelial polyps of the skin. This is a classical polyp. Polyps, by definition, are benign. You can suspect this is benign because it has a nice smooth margin. And even though it's big and it doesn't appear to invade anything. You can notice there's an area here of hemorrhage, however, which anything is allowed to have. Let's take a look at it under the microscope. You can see the thick wall of myometrium right here. You can then see that this is all polyp. You can see where the polyp attaches to the endometrium. You could notice that when you look at the glands of the polyp, whether they're these wide distended cystic glands with strips of mucosa like you see here, or whether they're little irregular sinusoidal snake-like clumps of glands. The glands themselves look very uniform. They don't appear to invade. They are uniform, round, they are nice. Here's another area in which you could see that they appear to be rather uniform, although they're not as thin as they are. And this is classically what the cells look like of an endometrial polyp, which are all benign by nature. If, however, you found a focus of adenocarcinoma in here, which is possible, you would no longer call it a polyp. You would call it an adenocarcinoma. This is just a boggy or lumpy or polypoid overgrowth of mucosa. Often they are not associated with increases in estrogen, but if they are very, very juicy and glandular and perhaps multiple, they could be associated with hyperestrogen secretion. Let's get another forest view of the forest. Notice the variation in the glandular configurations from the sinusoidal to the large dilated cystic spaces, having a nice little superficial rim of uniform glandular mucosa as well. Notice we got some blood vessels in here. That's probably why we saw some hemorrhage. Let's see if we could find some hemorrhage within here like we saw on the gross specimen. Oh, actually, I don't really see too much, but we do see blood vessels within the stroma, or the area between the glands. So this is your garden variety, run-of-the-mill, nice, benign endometrial polyp.